Let's face it, controlling your blood glucose can be a real pain in the butt, and something that you probably never asked for in the first place. Nobody wakes up thinking, I can't wait to control my blood glucose today, especially if controlling your blood glucose is a struggle. And let's face it, blood glucose control can be a struggle from the moment you wake up in the morning until the moment you fall asleep at night. Sometimes it keeps you up all night. I never asked for type 1 diabetes.
And I certainly never asked for type 1 diabetes myself. But yet, despite the fact that we both live with type 1 diabetes, which requires more attention to detail than almost any other health condition, we're able to control our blood glucose with precision and dramatically reduce our risk for long-term complications. Most people think that the complications of any form of diabetes, whether it's type 1 diabetes, type 1.5 diabetes, pre-diabetes, type 2 diabetes, or gestational diabetes, are inevitable, and that it's only a matter of time before they develop some frustrating collection of symptoms that decrease their quality of life. And we'll be honest with you, not only is the list of diabetes complications long, it's downright scary. These complications include dangerous problems like heart disease, high cholesterol, hypertension, stroke, fatty liver disease, chronic kidney disease, and Alzheimer's disease, and also include more common conditions like heartburn or acid reflux, poor digestion, bloating, gas, constipation, diarrhea, abdominal pain, numbness and tingling in your arms and legs, known as peripheral neuropathy, unwanted weight gain, or an inability to lose weight, a foggy head, a poor memory, a lack of focus, or just plain old low energy. And the truth is that most people live with some combination of these complications for years without even knowing about it before they become obvious enough to do something about.
Most of you know I was first diagnosed with type 1 diabetes in college. And when I was, my life got difficult, and it got difficult fast. You see, I was diagnosed with type 1 diabetes at the age of 22 in my senior year of college at Stanford University. I was studying for finals, and I remember feeling very low energy and ridiculously thirsty. For 2 to 3 days, I remember running to the bathroom 17 to 20 times per day, and yet no matter how much water I drank, my thirst got larger. I was confused. Surely I'd been thirsty in the past, but never this thirsty. But I just kept on trucking along, thinking everything would pass. After a few days of thirst, of low energy, and of a difficult time concentrating on my schoolwork, I picked up the phone to call my sister Shanaz, a family practice doctor. I explained my symptoms to her, and she said, Cyrus, drop everything that you're doing right now and go straight to the campus health center immediately. I took her advice. I walked to the campus health center. It was the longest walk of my life. At times, I felt like if I just turned around that nothing bad would happen to me. But I checked myself into the health center within 30 minutes. I sat down at the reception area, confused about why I was there in the first place, and I was unsure of what was going to happen. And I was growing more and more impatient by the minute. There, they found out that my blood glucose was over 600 milligrams per deciliter, 6 times higher than normal. They recommended that I go straight to the emergency room, so I did. There, they hooked me up to monitors and began IV saline in one arm and IV insulin immediately. Preoccupied with impending bad news, I sat in the hospital bed, terrified. After a few hours, my team of doctors asked me a series of detailed questions about my health history, and then they diagnosed me with type 1 diabetes, the autoimmune version of diabetes that usually affects children and adolescents. Just like that, out of the blue, no warning, no heads up. Or maybe there was. You see, in the 6 months prior to that diagnosis, I had also developed 2 other autoimmune conditions: Hashimoto's hypothyroidism, which is an autoimmune version of thyroid disease, and alopecia universalis, which is why I have no hair, no eyebrows, no eyelashes, no armpit hair, no nose hair, no chest hair, nothing. That means that type 1 diabetes wasn't my first or my second, but my 3rd autoimmune condition, and it all happened within 6 months. To say that I was scared would be an understatement. I was terrified. My doctors flat out told me that they had never seen a patient with a quote-unquote polyglandular autoimmune condition. They had only read about it in textbooks. Great, I thought to myself. Now what? The next day, I was discharged from the hospital with a blood glucose meter, with test strips, with a prescription for basal insulin and bolus insulin, with a box of syringes, with a carbohydrate counting guide, and a somewhat cryptic piece of paper with discharge information about how to return to quote-unquote normal life. Even though I did my best to remain calm, I returned to my dorm room that day terrified that something was very wrong with me. I felt alone. I felt victimized. And I didn't know a single other person on this planet living with type 1 diabetes that I could contact for guidance or for support. I just told myself that I could figure this whole type 1 diabetes thing out, even though it was clearly much more complex than a simple math or engineering problem. I began eating a low carbohydrate diet because that's what my medical team told me to do. And I counted carbohydrates in my food as if it were my new job. But no matter how diligently I controlled my diet and my exercise patterns, maintaining my blood glucose within a normal range took most of my mental, emotional, and physical energy every single day. I felt vulnerable, I felt weak, I felt confused, and I grew increasingly angry because there weren't many answers. Often, when I asked a simple question, I was given the same response every time. Well, Cyrus, you see, everyone's different. About 9 months into living with diabetes, I came home one day from work, and I was excited to eat dinner. In preparation for my dinner, I checked my blood glucose, and it was 3 times higher than the normal range, something in the very, very high 200s. My body felt stiff. My muscles were sore to the touch. My hamstrings were tight, my back was rigid, and I was just flat out tired. I was doing everything that I could do. I ate a low carbohydrate diet, and I exercised regularly. But despite that, my blood glucose was a nightmare. I was a 23-year-old living in what felt like the body of a 90-year-old. And I can't tell you how frustrated that made me. For heaven's sakes, I just graduated with a degree in mechanical engineering, and I was trying to control my blood glucose, and it was by far the most challenging problem that I had ever come across. No matter how hard I tried, no matter how many variables I worked to try and control, no matter how systematic I was about documenting every daily activity, my blood glucose meter acted like a random number generator. And that made me really, really angry. In that moment of frustration, I heard a voice in my head that said, Cyrus, you're 23 years old, but you never learned how to eat. Learn how to eat and it will change your life forever. So I listened to that voice. And I began searching for information wherever I could find it. On the internet, at a bookstore, in recipe books, at scientific lectures. And I noticed that practically every avenue that I opened up pointed me towards one thing called plant-based nutrition. And I knew nothing about plant-based nutrition. So I began eating a more plant-based diet that included lots of tomatoes, carrots, eggplants, peanut butter, mushrooms. You know what? I really liked it. Then I slowly stopped eating foods like steak and eggs and cheese, meatloaf, chicken, and turkey. Before long, I started to feel much better. But I still couldn't control my blood glucose with precision. And I knew that there was a whole world of human biology which I didn't understand anything technical about. After a few months of dabbling in this plant-based nutrition world, I eventually gathered the courage to work with a nutrition coach named Doug Graham. And he instructed me to do the exact opposite of what I had been advised by my medical team. He taught me how to eat large quantities of fresh fruits and vegetables and stop eating meat, dairy, fish, poultry, eggs, and grains entirely. I was excited, but I was also nervous that eating more fruits would increase my insulin use considerably, because that's what conventional wisdom had taught me. Now here's where it gets real interesting. I'm still counting my carbohydrates in order to take insulin, and I increased my carbohydrate intake from about, 100 grams per day to about 500 grams per day, 5 times as much as I had eaten previously. And what happened to my blood glucose control and my insulin use? Well, my blood glucose started falling like a rock. So I began backing off on the amount of insulin that I needed to inject every day. 42 units became 37, 37 became 32, 32 became 29, 29 became 23. My insulin requirements dropped by approximately 35% in 1 week. My energy levels increased, my blood glucose became significantly more predictable. I felt hopeful for the first time since being diagnosed with type 1 diabetes, and that was very reassuring. Suddenly, this puzzle called diabetes started to make a lot more sense. Finally, this thing called diabetes became much more controllable. It felt like a best friend who immediately let me know when I was headed down the wrong path. For the first time, I felt like my life with diabetes was actually enjoyable. When I returned home to continue this lifestyle, my blood glucose control got even better. My A1c that started at more than 8% at diagnosis had dropped into the low sixes, and my energy levels went through the roof. I knew that I was onto something, and I literally could not think of anything else more important in my life. Nothing else was more important than this problem. For the better part of the next decade, I worked towards a PhD in nutritional biochemistry at UC Berkeley, studying the ins and outs of diabetes. What causes it, how to reverse it, how do you use your food, what is calorie restriction, and how does exercise work. I was super excited by this scientific experiment underway in my body and learning the biology about blood glucose control that kept me up at night previously. I learned a few non-technical things too, like even though I considered myself to be a freak of nature, I wasn't. I learned that there are simple nutrition strategies that apply to all individuals living with diabetes, including those with type 1 diabetes like myself, and those living with type 1.5 diabetes, prediabetes, type 2 diabetes, and gestational diabetes. Years later, through graduation, the ups and downs of new life experiences, marriage, and friendships, diabetes isn't frustrating anymore. Diabetes is far from frustrating. It's part of who I am and everything that I do. It's that little puzzle piece that grounds me and keeps me happy because it reminds me to do the right things for myself every day. It's not difficult to control my blood glucose anymore. I'm not angry that I have type 1 diabetes. I'm not even interested in finding a cure, for heaven's sakes. Why? Because I learned how to control my blood glucose with precision and simultaneously reduce my risk for chronic disease and be able to teach thousands of people around the world how to do the exact same thing. Without question, type 1 diabetes is the best thing that ever happened to me because it opened my eyes to a world of evidence-based nutrition can not only help me, but it can transform the lives of thousands of people around the world. It certainly transformed my life, and I'm forever grateful.
I'm Robbie Barbero, and when I was 12 years old, I was diagnosed with type 1 diabetes on January 26, 2000. Stephen, my older brother, had been diagnosed with type 1 diabetes 9 years prior, so I was familiar with the symptoms and what he had to do to control his blood glucose. At the time in my life, I was incredibly thirsty and urinated very frequently. I said to my mom, "I think I have diabetes just like Stephen." And she responded by saying, "Don't be silly, Robbie." A few weeks later, my parents had left our home in St. Cloud, Minnesota to visit my grandparents in Florida, where we were gonna move very soon. My mom called to check in and I told her that I had difficulty sleeping the night before and that my legs were cramping. At this point, she became concerned. She instructed me to go upstairs and use Stephen's blood glucose meter. A few seconds later, I saw my blood glucose for the first time and it was over 400, more than 4 times higher than normal. My doctor confirmed that I did have type 1 diabetes, and my brother Stephen was crying in the room saying, "I'm sorry that you have to deal with the same thing I have to." My dad reassured me that type 1 diabetes is merely an inconvenience and that I would still be able to do whatever I wanted. To this day, those words are still in the forefront of my mind and are a daily reminder that I choose not to let type 1 diabetes get in the way of achieving my dreams in life. In fact, type 1 diabetes has given me a newfound mission, which has filled my life with growth opportunities, community, purpose, and joy. I'm a type A personality, and because of that, I took my diagnosis very seriously from day one, managing my blood glucose to the best of my ability. As a child, I played tennis competitively and worked hard to become one of the top-ranked tennis players in the Midwest region between the ages of 10 and 14. I grew up with the typical athlete's mindset. I could eat whatever I wanted because I was getting plenty of physical activity. I started changing my nutrition habits by taking daily supplements that my dad sold. By the time I was 14, I had eliminated virtually all junk food from my diet, avoided additives like MSG, and made an effort to eat as much unprocessed food as possible. Despite eating a cleaner diet, I suffered from allergies, even though I routinely took medications like Claritin D and Nasonex. I also suffered from plantar fasciitis, a painful condition that made the soles of my feet tight and very painful, and I wore big blue boots at night for passive stretching to deal with this. Throughout high school, I had battled with cystic acne and treated it with everything I could get my hands on, from creams to oral pills, microdermabrasion to laser treatments, and eventually Accutane, the medication doctors prescribe only if nothing else has worked. Accutane is known for severe side effects, including depression and suicide, so I was hesitant to take it, but felt like I didn't have a choice. While in high school, I stumbled across a book that changed my life forever, called Natural Cures They Don't Want You to Know About by Kevin Trudeau. I remember walking away with the belief that I can and will reverse type 1 diabetes and that one day I will no longer need to use insulin to manage my blood glucose. It was the beginning of a series of desires to solve the mystery of type 1 diabetes, to learn about autoimmunity, to learn how stem cells could lead to new beta cell growth, and to try anything in my power to reverse type 1 diabetes in my own body. Now, I do want to say Kevin Trudeau has since been imprisoned for misleading health claims and fraudulent advice. We do not condone his advice. It merely was a book that planted a seed to learn more about evidence-based lifestyle change for me. My search for better health has taken me to a lot of unusual places, including a naturopathic doctor in Tampa, Florida, who gave me supplements after every office visit and a long list of approved foods and guidelines that said things like eat chicken but not beef and eat bread from millet but not spelt. I followed her advice and soon became the weird one at the high school lunch table. Next, I came across the Weston A. Price Foundation and became convinced that it was smarter to drink raw milk instead of pasteurized milk, and eating grass-fed beef instead of farmed beef would be better for my health. I also flew to San Jose, California and met with an underground Chinese medicine man who made me a nasty tea and instructed me to take it every day. The tea smelled so bad that I had to brew it on the sidewalk to prevent my college roommates from kicking me out. I continued to search for solutions. Next, I came across a doctor named Gabriel Cousins. He recommended eating a raw, plant-based ketogenic diet in which I ate approximately 30 grams of carbohydrate per day. My total insulin use dropped to about 10 units per day, which was great, but I felt terrible. I suffered from extremely low energy and I blacked out several times on campus. It was obvious that I was trying various tactics, but that I still hadn't found a dietary approach that could ensure my long-term health and keep me feeling energetic, alert, and vibrant for many years to come. My naturopath recommended that I try chelation therapy to eliminate heavy metals, and that was super expensive, so I was hesitant but ready to sign up because I would do anything. Then one day, I listened to a podcast that changed the course of my life forever. It was a podcast with the same nutrition expert that helped Cyrus, Doug Graham, an educator who helps people adopt a low-fat, plant-based, whole food diet. I began a 90-day email coaching program with Dr. Graham, who taught me the fundamental principles of why a low-fat diet, high in fruit, was not only great for my blood glucose control, but also great for my overall health. I began adding more fruits to my diet, including bananas, mangoes, cantaloupe, papayas, grapes, oranges, persimmons, and dates. Even with all the education and reassurance from Dr. Graham, I anticipated my insulin use would skyrocket given the carbohydrate content from fresh fruit. But instead, I watched as my 24-hour carbohydrate to insulin ratio increased from 3-to-1 to 22-to-1. That means that I was finally able to metabolize carbohydrate energy efficiently. To this day, I think that signing up for this coaching program was one of the best decisions I have ever made. For the first time since being diagnosed with type 1 diabetes, I began to feel amazing and had a newfound optimism for life. I helped operate a company called Forks Over Knives for 6 years to spread life-saving information. And here we are today, teaching the Mastering Diabetes method to thousands of people around the world with tremendous impact. Since December of 2006, I've eaten a low-fat, plant-based whole food diet, including an abundance of foods like mangoes, papaya, figs, plantains, and small amounts of nuts and seeds, and I'm able to control my blood glucose with precision. I eat approximately 750 grams of carbohydrate per day, the majority of which comes from fruit. My A1c values are between 5.3% and 6.6% for the past 12 years. I don't use any medications other than insulin. I have abundant energy, my acne is cleared up, and the mysterious symptoms of allergies and plantar fasciitis are things of the past.
If you've ever experienced the frustration that comes along with not knowing the answer to your health, then join the club. We'll be the first to tell you that living with heartburn, with numbness and tingling in your arms and your legs, with unwanted weight gain, low energy, or any mysterious collection of symptoms can be really frustrating, especially when beginning to try to fix each one of these problems using a different approach doesn't work, and especially if these attempts drag you down. It's time consuming, it's expensive, it's energy draining, and it's a thankless process that sometimes works, but most of the time doesn't.
But don't worry, in the upcoming videos, we'll teach you how many common health conditions like bloating, weight gain, low energy, acne, allergies, inflamed skin, and frequent headaches are actually related to one another. And they're very common when you're also living with any version of diabetes, whether you have type 1 diabetes like Cyrus and myself, type 1.5 diabetes, pre-diabetes, type 2 diabetes, or gestational diabetes. But before we get there, we want to hear from you. What symptoms are you struggling with right now? Is it heartburn, high cholesterol, fatty liver disease, low energy, variable blood glucose, a mysteriously high A1c? Are you having trouble losing weight and keeping it off for good? Is your blood pressure high and not coming down?
Whatever the answer, take 2 minutes and tell us what conditions you experience in the comment box on this page. And please, don't be shy. The more you write, the more we can help. But remember, because the Mastering Diabetes method is so effective, it's important to implement these changes with the help, support, and the knowledge and the guidance from your physician. Now, many people living with diabetes around the world have found that the Mastering Diabetes method results in a strong reduction in their requirement for oral medication, for insulin, or both, and that working with your doctor is incredibly important when making these changes. So head to the comment box and write down the frustrating symptoms that keep you up at night, and we'll see you in the next video.